Thank you, Mr. Chairman. Mr. Secretary, just to build on what my colleague just said, this system is opaque, and the incentives are frequently perverse in drug pricing. Pharmacy benefit managers, for example, are often hired by insurers to negotiate on their behalf with pharmaceutical companies. But the fact is that the PBMs make more money if they are paid a percentage of a higher list price. So the problem is that the pharmaceutical companies know that the PBMs are going to control whether or not their drug is listed on the formulary of the health insurance plan. So doesn't that give PBMs enormous leverage and create an incentive for higher list prices?
And Senator, thank you for that. And that is exactly, I think, what this committee saw when you had the heads of the pharmacy benefit managers, distributors, everyone in the channel, and they all were here pointing fingers at each other. Now let's start first. The drug companies set their list prices. Okay, so first they're accountable for setting their prices, but there are very important financial incentives that make that work, and one of them is the PBMs benefit from higher list prices because of how these arrangements work. It's rather a startling and perverse system that has evolved over time, and that's why this blueprint suggests the comprehensive tackling and restructuring of the drug channel, nothing short of that.
I was very pleased this morning to hear you endorse the prohibition on gag clauses on pharmacists, which actually prevent them from telling a consumer, unless the consumer asks, whether or not they'd be better off not using their insurance and paying for a prescription drug out of pocket. I was behind a couple at the pharmacy counter recently who found out that their copay was $111 and said, we can't afford that, and walked away. And I asked the pharmacist, does this happen often? And he told me every single day. And that really troubles me. It was pharmacists who brought to my attention the fact that these gag clauses exist. I know that CMS Administrator Verma has issued a letter telling plans that the agency will no longer tolerate gag clauses in Medicare drug plans. But that leaves out the plans on the exchanges and other health plans. Are you planning to take similar action? And don't you think we really ought to pass legislation that Senator Casey and I have introduced to apply to the Affordable Health Care plans, and that Senator Stabenow and I have introduced to apply to Medicare and Medicaid, so that we can put this in law?
So we agree with you. I appreciate you were the one who raised this to my attention during the confirmation process, and we find this unconscionable. And so we will look forward to working with you and other senators on legislation that would, across the spectrum, deal with the issue of these gag clauses and getting that to stop. Because we think the patient should have the right to know what their out-of-pockets are and what their lower-cost alternatives are.
And most patients are not going to assume that if they don't use their insurance, they'll get a better price.
Right. It would seem to the average person it's not intuitive.
Right.